All right, let's talk about a new drug that's making some serious waves. We're seeing weight loss numbers so high, they're actually starting to compete with bariatric surgery. It's called Retatrutide, and in this explainer, we're going to dive deep into the incredible science behind it. So, the big questions are, right? How does this thing even work? And maybe more importantly, is it safe? We're going to break all of that down, looking at the wild results from the clinical trials and, of course, the safety profile. Let's get into it. Okay, so first things first, let's meet the star of the show. This is Retatrutide. It's being developed by Eli Lilly. Yep, the same folks who brought us Mounjaro. Right now, it's deep in late-stage trials, and a lot of people are already calling it a next-generation metabolic medicine. So you might be wondering, what makes Retatrutide so special? Why all the buzz? Well, the answer is in its pretty unique scientific design. See, this isn't just another GLP-1 drug. It's what's called a first-in-class molecule, meaning it's the first of its kind. It really attacks the problem from a few different angles at once. Okay, so that fancy term for it is a triple hormone receptor agonist. What does that actually mean? Well, in plain English, it's one single molecule that's built to flip three different switches in your body that control metabolism. You know, other drugs might hit one switch, maybe two, but hitting all three at the same time, that's what makes this a totally new playbook. So here's how that three-pronged attack actually works. First, you've got the GLP-1 receptor. This is the one that helps reduce your appetite. Think Ozempic. Then it hits the GIP receptor, which is kind of like Mounjaro, helping your body handle insulin and fat better. But here's the kicker, the real game changer. It also targets the glucagon receptor. This one actually boosts your body's energy expenditure. In other words, it helps you burn more calories. It's a triple threat. Okay, so that's the science. It sounds cool, right? But how does it actually play out in the real world? Well, the data we're seeing from the clinical trials is, honestly, it's staggering. It's really pushing the envelope on what we thought was even possible with the medication. Get ready for this. The headline number from the phase 2 trial is just wow. People on the highest dose lost on average 24.2% of their body weight, and that's in just 48 weeks. I mean, to put that into perspective for you, that's getting into the same neighborhood as bariatric surgery. That is a massive paradigm shift in how we think about treating obesity. And if you want to think about that in pounds, well, a later phase 3 trial saw people lose an average of a whopping 71.2 pounds over 68 weeks. Just think about that. It really shows you the kind of profound, long-lasting impact this drug can have. But what's really fascinating when you look at the chart is the direction of the weight loss. See how those lines for the higher doses are still heading straight down at the 48-week mark? There's no sign of them leveling off, no plateau. And that suggests that if the treatment went on even longer, the final weight loss could be even more significant. But, this story is about so much more than just the number on the scale. What the trials showed was this incredible domino effect of improvements across a person's entire metabolic health. It really makes you think, maybe Retatrutide isn't just a weight loss drug, but something that can actually tackle metabolic disease at its root? And the data on this is just so compelling. For instance, in the phase 2 trial, a full 72% of people with prediabetes saw their blood sugar levels go back to normal. We also saw major drops in markers for cardiovascular risk, huge reductions in blood pressure, and, get this, for people with knee arthritis, pain was reduced by as much as 75%. That's just incredible. The drug also turned out to be a powerhouse against something called MASLD, or what's commonly known as fatty liver disease. For people on the highest doses, Retatrutide pretty much eliminated the excess fat in their liver. That is a massive, massive breakthrough for what is a very common and very serious condition. So, okay, with all these amazing results, the big question on everyone's mind has to be, how does this new drug stack up against the big players already on the market? This table really lays it all out for us. You can see right away that Retatrutide delivers the highest average weight loss. It beats out both tirzepatide and semaglutide. But there's always a but, right? That top-tier performance does seem to come with a trade-off. It also has the highest reported rate of nausea of the three. And that brings us to a bit of a reality check, because that incredible performance and those side effects are really tied to how the drug is taken. And that involves some pretty important things to keep in mind. So, to deal with those side effects, especially the nausea, doctors in the trials use a start low and go slow approach. Patients begin on a tiny 2 milligram dose once a week. Then they bump it up very slowly every 4 weeks.
This gradual increase or titration is absolutely crucial. It gives the body time to adapt and makes the whole process much more tolerable.
It's probably helpful to think about the side effects in two different buckets. In the first bucket, you have the really common stuff, mostly stomach issues like nausea, diarrhea, that kind of thing. They're pretty much expected and tied to the dose. But then in the second bucket, you have the rare but much more serious risks like pancreatitis that everyone, both patients and doctors, needs to be aware of. And don't just take my word for it, this is coming straight from the researchers themselves. This quote here from the big publication on the phase 2 trial basically says, yep, the stomach issues are common, but they're usually mild to moderate. And most importantly, they can be managed by doing exactly what we just talked about, starting low and going slow. Now, here is a really, really important disclaimer. Despite all this fantastic data, Retatrutide is still technically an investigational drug. It's in the final phases of its trials, but as of right now, it is not approved by the FDA or any other regulatory agency for public use. That's a key thing to remember. And of course, it goes without saying, all of this is just for educational purposes. Any decision about your health, especially about a new medication, is a really serious one. And it's a conversation you absolutely have to have with a qualified doctor who actually knows you and your medical history. So all of this leaves us with one final, pretty provocative thought to chew on. For the very first time, we're looking at a medication that can produce weight loss results that are in the same ballpark as major surgery. So the big question is, are we standing on the edge of a brand new era? An era where these powerful multi-agonist drugs could become one of our main tools for reversing obesity and metabolic disease on a massive scale? I guess only time will tell, but the next few years are going to be absolutely fascinating to watch.